So, what are some of the risks for being in a melanoma clinical trial that patients might face?
I think any treatment, whether it's part of a clinical trial or outside, will have some risks, right? There's no free lunch, as they say. So we should carefully, I think, as providers, make sure we explain what some of those risks are. It may be that the treatment has some side effects, and those side effects will require their own medication or their own management. Those side effects may be long term or irreversible. They may affect somebody's quality of life. So perhaps the melanoma clinical trial is improving their tumors and improving their duration of life, their quantity of time on Earth. But if it's with deteriorated quality due to side effects, we should make sure to explain what those might be. Clinical trials also don't work for everybody. So, one of the risks is that you sign up for a trial and the treatment just may not be effective. In that case, the informed consent document that we typically use or the treating team should be able to explain what alternatives might be if you didn't want to participate. And of course, what would happen after the clinical trial? How would you be followed after if the treatment works or doesn't work? In a lot of clinical trials, you may not have a choice about which treatment you receive. So there may be pre specified designations or it may be randomly assigned. But the good thing about clinical trials, as with any treatment that you receive, is that you can change your mind at any time. So just because you say yes on one day doesn't mean you're stuck on that treatment. You can certainly have a conversation and say, I don't think this benefit risk, analysis or benefit risk association is good enough for me to continue, and you can change your mind.